Tell me about how you feel now when you see people coming in and saying, here's my picture I put on ChatGPT, it's recommending me this.
It's interesting what's happening, but it is in many ways scary as well, because you will no longer be able to tell what's true from not in terms of photos, videos. There'll be so much fakeness around that people will stop trusting the system. So I'll tell you frankly, Judy, I wished we had less technology around.
Today, my guest is Dr. Dany Touma, a US-trained, American board-certified dermatologist. He's a pioneer in facial rejuvenation, skin cancer surgery with over 10,000 procedures performed. In this episode, we're going to explore why aesthetic medicine itself isn't the problem, but how its practice can be. What we want to do is show you a video, and I want to see your reaction, okay? Here we go.
A lot of people who have been getting, the commercial treatments, the trendy treatments of big cheeks, big jawlines, huge lips, are coming back and saying, you know what, I don't see myself anymore. I really want to go back to that graceful aging and look myself. And I've always believed in one thing, which is
Today's episode is sponsored by Loris Organics, a premium wellness distribution company. Because the truth is, we can elevate our health by making more conscious choices about what we put on our skin. Because Loris's ethos is what goes on, goes in. Loris brings certified organic skincare like Nage in France to the GCC region, aiming to make organic skincare more accessible and convenient to find, with a natural approach to anti-aging. Explore the range at lorisorganics.com. Now go enjoy the episode. Hello, everyone. Welcome back to Balance Not Boring. Our episode title is called Forever 35 Face, Aesthetic Medicine, Aging, and Losing Ourselves. Today, we want to talk to you about honesty. Honesty about skincare and aesthetics and beauty and identity. We live in a time where aging feels almost forbidden. Every line is questioned, every photo is filtered, every face feels like it needs a before and after. As a woman, a mother, and someone who works in wellness, I sit with this tension a lot. I want to feel good in my skin, but I don't want to lose myself to unrealistic standards. I don't think wanting to look good is wrong, but I do think there's something that's shifted, which is fear, pressure, and comparison. These things are driving decisions more than education and self-connection. The episode isn't about shaming cosmetic work, it's about understanding it. When does enhancement support us? When does it erase us? And how do we protect our individuality in a world obsessed with youth? Today, my guest is Dr. Dany Touma, a US-trained, American board-certified dermatologist and dermatologic surgeon with advanced training from BU, Boston University, and Tufts University in the USA. He's a pioneer in facial rejuvenation, laser technology, hair restoration, skin cancer surgery with over 10,000 procedures performed. He has held senior leadership roles in the US, including Director of Cosmetic and Laser Surgery at Boston University, and is the founder of Skin Experts Polyclinic in Dubai and the Skin Clinic in Beirut, known for a deeply ethical, patient-first approach to aesthetic medicine. In this episode, we're going to explore why aesthetic medicine itself isn't the problem, but how its practice can be. The difference between aging well and losing identity, how social media filters and influencer culture distort beauty standards, why lack of expertise causes more harm than people realize, and what aging well actually look like physically and emotionally. So welcome, Dr. Dany.
Thank you, Judy. Thank you for having me, and great intro. Didn't have to go that long on my credentials, but
you have a lot. We have to. We can't skip over this. It's so important to this specific conversation. I mean, I'm actually in the age group that we're targeting. So first, what we want to do is show you a video, and I want to see your reaction. Okay, I'm not going to tell you what it is. You're just going to watch it. Watch it from beginning to end. And let's see. Here we go. We'll insert this for the audience. Maybe you've seen this video already.
No.
So watch and let me know. It takes 30 seconds.
Okay.
You can see a pattern here.
The pattern of, beauty all the time, the pressure, looking great, looking amazing, doing things. It's my field. It's what I do, but it's like tiring to see always new things, people, changing. But for once, I'm seeing something interesting. It's something I haven't seen before, where people who look like they were overdone at some point are going back to normal, beautiful faces.
Yes.
And this is what I'm actually living in my practice. A lot of people who have been getting, the commercial treatments, the trendy treatments of big cheeks, big jawlines, huge lips, are coming back and saying, you know what, I don't see myself anymore. I really want to go back to that graceful aging and look myself.
Exactly.
And I can say proudly that I've never really followed trends, and I've always believed in one thing, which is what we do should be about restoration, restoring skin. And this is where the dermatology background comes in. In your title, Judy, you mentioned aesthetic medicine, and this is a huge trap. With all due respect to my colleagues, doctors all over the world. But this is why, being in the hands of a dermatologist or a plastic surgeon, or really someone who has had major advanced training and studies is important, because the trend today is that, aesthetic medicine is really, we're specialized in aesthetics, and we're not, because a lot of what's happening in the aesthetic, quote unquote, medicine world are, low-level training, GPs, in some countries, dentists, and others, nurses, who have so little, if no training in knowing exactly what the skin is about, the histology of the skin, the physiology of the skin, the anatomy of the face, and they're just learning to do certain procedures. And these procedures are usually taught by the industry, and the industry is telling them, do this 1, 2, 3, 4, codes, of fillers, codes of doing that. And this is why you see these trends of people looking the same. Big cheeks, big jawlines, big lips, because, you just follow a certain procedure. You don't even have to think. And that sells very well for the industry. Instead of the Dr. Toumas of the world who are doing conservative work, restorative work to bring the face back to its beautiful shape that this video is showing, this takes a ton of expertise, because when you're working on restoration, you're bringing back the integrity of the surface of the skin with lasers, with peels, with, all the things that we do in the clinic. You're bringing back the elasticity of the skin with the HIFU, with the RF, with microneedling with RF, with the skin boosters. You're bringing back the volume with a little bit of filler, not a lot. Too much is causing, all this escape today from the cosmetic dermatology to surgery, because there has been this trend of so much fillers that people think equate fillers with a certain look. Fillers should be used judiciously with just a small amount in certain areas that can really restore a normal shape of the face, and they should not be used. So 1 or 2 syringes is my average. What you see in those pre-pictures in this video are like 7, 8, 9, 10, syringes,
MLs,
which, give you that standardized look, and they sell very well for the industry, but they've really turned off a lot of people who are conservative, who want to look, just good, want to look rested. They don't want to look older, but they don't want to change. And this is why you mentioned the word ethics, and ethics in this field is doing just, science-based procedures. So no procedure is done without really knowing the science and knowing that it will actually make a difference for someone. Because I see a lot of people coming in, I want this, if it's not really useful for that person, I'll say, no, this is not adapted for you, or it will give you such a low return in terms of improvement. I would customize, the suggestion and explain to them that maybe they need something else that is maybe less costly or even, trivial for them. So this is where the expertise is important, and it's getting lost, unfortunately. And the sea of misinformation, social media, of course, has been a major vehicle for that. And we're going to talk about this.
Yes, we have all. So on this video, I can take the phone. So for example, you see that these are actually celebrities that you recognize. They actually look better pre than post. So they're showing in this video, my interpretation is removing that fake mask to the original identity of that person. So sometimes less is more. And you actually go into this a bit in your article on LinkedIn, where you wrote something really, really impactful at the end. You wrote, unfortunately, where there is beauty emerges a beast. Can you tell me more about what you mean by that?
Yeah, let me tell you a bit of a background. This was in response to an article in the Financial Times Weekend edition by a really very smart editorialist who's in her mid-40s, I think. And her article really reflected the confusion of a very smart lady who lives in London about what to do with her face. She was, saying that she's starting to age a little bit, and she's not sure whether she goes the non-invasive injection route, but she doesn't want to look botched. So even she equated, this look with being botched, and she gave the example of Simon Cowell. Okay, looking, with his big cheeks, with his eyebrows down, and so on, and confused whether she should go and get the surgery that everybody's talking about, the plastic surgery, deep plane, all sorts of names with like big influencers that get a good result. And people think that everybody's going to get that good result. And what people should know is that this one great result is covered with makeup. There is maybe Photoshop. There is maybe some weight loss at the same time that caused a bit of slimming of that face. There is maybe a big scar that is hidden, that, there's a risk of complication and so on. So we are in 2026. And today, with all the advancements of surgery and minimally invasive surgery and the things that we do as dermatologists, I assure you, Judy, very few people will really need the facelift unless they want to look extreme, unless they're in a field where they always want to push the boundaries. And the thing that we were talking about when you showed me this video is that, that expertise is so rare. And that's what I wrote in that article, that in the UK, I think there are 75 graduates every year that in dermatology and plastic surgery. And of those, how many are really interested in the aesthetic field? So there has been a huge vacuum of so much demand, yet so little offer. And that's where so many people jumped on the bandwagon and started offering their things. And this is what I meant by where there is beauty and, really doing things properly in an expert way, in a subtle way and beautiful way. And then you get people who really want to say, oh, we do it as well, and then things go in all sorts of directions. Yeah. And this article also, I gave the example of two male celebrities, one being Simon Cowell, that she mentioned in her article, and I said, you have Tom Cruise, who also has the same age. They're both 66, and you look at Tom Cruise. He looks amazing. You see him in Mission Impossible.
He looks the same.
I was like looking for that scar somewhere. Yeah. And clearly he hasn't had a facelift. But what he's had is proper expert care, a different level of care. What Simon Cowell has had is the heavy dose Botox that caused his brows to go down, the typical cheek filler that is not necessarily adapted to, all people. In fact, in my practice today, I rarely do a cheek filler. I do temples, I do a bit, around the nose, slightly in the cheek, sometimes down here. And I'd rather do tightening procedures because a smaller face looks more elegant. It looks younger, it looks nicer. The big faces that have been so popular are kind of Instagram
filter. They're a filter.
Not only this, but when people look at the profile, they see a nice sharp angle. But when you look at them straight on, you see wide angled faces, square faces that look masculinized, that don't look, attractive in my opinion. So it's really the level of care that matters. And unfortunately, it does not correlate with the reputation of the doctor, because so many doctors who are busy working in their clinics, they're not so, don't have much time to be on Instagram and doing things. And for the longest time since social media exploded, I honestly call it kind of the dark ages of our specialty, because anybody could claim to be anybody, with no training, with no nothing. All that mattered was, number of likes, number of followers, how many influencers you hug and take a picture
it's
with.
Scary, yeah.
And it's your work didn't really matter. So now with AI, we have maybe another cycle that is more interesting, and we can talk about that
Yes, we're going to get into ChatGPT and
Yeah.
AI and all of this.
Yeah.
It's like an added layer.
Yeah.
But how about this? So for example, lots of people are studying dermatology, whether registered nurses all the way to doctors, and you have everything in between. This is what you're saying. But how about clinics, types of clinics even? So there's med spas. It's a trending thing where you see med spas offering the same treatments than like a dermatology clinic. Even me, for example, I was researching a laser for myself, and I saw the same laser offered at a med spa where I do my eyebrows, and also the same laser at a dermatology clinic. I honestly did go with the dermatology clinic because I naturally thought maybe that the person doing the procedure would know more. That was my own stereotype.
Maybe, it's definitely.
Yes. So what's your take on this?
It's the expertise. You can look. I give the example of the Ferrari. You buy the Ferrari. If you're not a good driver, you're not going to drive it well. And if you might even, crash it and, kill someone or kill yourself. So these devices have been so commercialized and kind of banalized that people think that it's okay as long as someone is doing it for me. And I see it time and again. people who go into cheaper places, even people who can afford really, of course, when you're in a dermatology clinic, there are costs that people cannot imagine. And the economics of things are understandably, difficult. Good medicine, Judy, costs money.
Yeah.
When you want to have the proper expertise, this costs money. The time that doctors take to train, to learn, to go to their conferences, to update is huge compared to someone who's learning on YouTube School of Medicine or learning, a course here and there, and they just learn to do something. You want someone before doing that procedure to first counsel you whether you really need it or not.
Yes.
2, you want them to use that procedure in the best possible way that's going to give you the highest level of efficacy and the highest level of safety. Okay.
Yeah.
And who's going to do other things who might, enhance this result. Again, you're not buying a service like, and I don't want to equate, with all due respect, to a nail spa or to a brow thing. This is a medical service that I'm always reminding people that, to take it very seriously. This is not, like the fake Chanel bag or the fake Vuitton, I can maybe fake it and it's okay. Maybe this is real medicine, and it's about safety. And it's when it's not about safety, it's about really getting nice results, because you can take it for granted that you're getting good results, but you're missing out on a lot when you go to the real expert who will do a better job and who might on the long term save you a lot in terms of surgery, a lot on unnecessary procedures that will cost money.
Yeah.
And the trap that is common when people go to the cheaper places, they'll end up doing more because they feel, it's cheaper, we're going to do this and more of that and more of the filler that is cheaper in the hands of the expert wannabe. They end up getting more of it. There's that Arabic proverb, al-ghali rkhis, when it's, the expensive is really cheap on the long term, because you're getting what's best for you and you're getting it done right.
Yes, because also I imagine that everyone has a different skin type, a level of intensity you can handle, the pigments.
Of course.
You cannot just go to one person and do the same result. It's going to affect us.
Our job is to, in terms of the safety, and this is important, for example, in the dosing of Botox, in how we do the filler, there's always, a risk of something going wrong. Our job is to do it safely, not to be heroes and make everybody look absolutely perfect. Perfection is unattainable. And the more you push the limit, the more you're pushing the limits of safety. And when things go wrong, as experts, actually, it's a bit, quite rare, but it happens. And any doctor says, I don't have complications, is not practicing. But when things go wrong, they're usually lighter. The problem can be recognized quickly and fixed, rather than many problems that we see today where, all these providers and injectors getting problems that are catastrophic. And the problem that is worse is that a lot of the patients who go to them do not file a complaint because they know they shouldn't have gone to them. They run to file a complaint against the doctor. But if they go to an esthetician who did a nose filler and they almost lost their nose because of a stroke in their nose from the filler going into a vessel, they don't report it. It's a crazy world.
Yes.
And I'm glad we're having that conversation.
Yeah, this platform is to shed light that medicine is medicine, whether it's aesthetic or not. It needs to be done carefully because this is dangerous. It can be dangerous. So how about even lasers and treatments? Like all the time we're seeing every year, every few months, a new laser's coming out. It's like the iPhone in my head sometimes. I'm like, which one? It's doing similar job, but it's claimed to be better. So how can we as customers who have no experience with skincare, we're not anywhere in the medical field, know which one should I actually invest in versus not? What's the right strategy?
Look, it's really the doctor who should and who will advise you. Looking at Instagram and seeing things, seeing promotions, or even your best friend or your mom, or whatever is suited for them might not be suited for you. Most doctors are ethical. Most doctors are honest, and we all know, doctors are also human beings, and you'll always have the black sheep here and there. But unfortunately, because this field is kind of perceived as less medical, there are abuses in this field. There is no question about that. So a good doctor who's has the expertise will always advise you on what's best for you and will give you a customized plan. And these today devices are essential in restoring the skin, the faces, the neck, body areas. Now we have devices like the HIFU, high intensity focus devices. This is a field that has been stagnant for like 10, 12 years, doing a great job on the face and neck. But now we have devices that work very well on body areas, the tummy, at 30, 35, you've had 1, 2, 3 kids or even no kids. You've lost weight from Ozempic or Manjaro.
Very relevant today.
Before you get to the stage of surgery, we have devices that can help people with, mild to moderate laxity, always in combination, and that's where the expertise comes in. Doing a combination of a few things is much more useful and efficient than a lot of one thing.
Yes.
And there's this known saying, when all you have is a hammer, everything looks like a nail. And that's why those doctors or these injectors who only do, Botox and fillers, they'll end up over Botoxing and over filling. The right mix is just the right amount of Botox, the right amount of filler in strategic places, using the devices properly to tighten the skin, using the skin boosters to regenerate. So it's a whole world of expertise and of, art in using them together to get those best results.
We're actually going to go into that soon to define a skin booster. But before that, I want to get into ChatGPT. So you're talking about a lot about how doctors have a human touch, a personal touch to see you live, not through a screen, see your skin quality, see the pigments, see what you're lacking, look at it as a big picture. It's important to go in person for these things because when you look at a filter to look at how you would look with fillers or ChatGPT, you upload your photo. Let's be honest, lots of people are probably doing it. It's cheaper, it's faster. Doctors are busy. They're like, I want a quick assessment, but that might not always be accurate. So tell me about how you feel now when you see people coming in and saying, here's my picture I put on ChatGPT. It's recommending me this. What's your immediate reaction?
Look, ChatGPT is a smart, whatever technology. And, unlike the period of, Instagram and the likes, now we have a much smarter platform that is screening all the information that's in the world, all the publications. Before it was just people claiming, unfiltered. For the longest time, and I've been around a long time, graduated started really my practice in 98. You were still in school.
we won't say our ages here. Yeah, it's okay. Fine.
No, but I have a ton of experience.
Yeah, of course.
So for the longest time, it was peer review, where it's your CV, it's the doctors who screen you. Your publications are in journals that are reviewed by big authority. Now anybody can claim anything on social media. Back to ChatGPT, it really does things differently. To recommend doctors, it looks at their profile, at their CV, at their credentials, at their titles, at how often they're mentioned, at their social media, and so on. So the recommendation, if you want, and that's something you didn't ask, but it's important, is coming out of a proper review.
So the filtering is good.
So the filtering is good. Whenever I look at ChatGPT or I see patient telling me, I've looked at, ChatGPT or some other Perplexity or Claude or whatever, and they, the recommendations are quite okay, but they're generic. They do not apply to that person in specific. Maybe in 2, 3, 4 years, they might, but it will take a lot of filtering and a lot of right input into this technology to get that. But nothing replaces that encounter with the doctor, Judy, the doctor, that rapport, that customization, that seeing the patient, that talking to them, getting their, seeing their energy, asking what they do for work. Are they a mom? Are they, single? Are they married? All this is so important in really personalizing any treatment, let alone a cosmetic treatment. So, and it's frustrating, on another hand, when I'm giving a recommendation, it's funny, I see patients on their screen while I'm talking, and then they take a breath and then they're typing, what do you think of this procedure?
No way.
Oh yeah, it happens all the time. And then, or people who come in and say, yeah, you're right, doctor, actually ChatGPT said that. So it's interesting what's happening, but it is in many ways scary as well, because, all of this AI revolution is going to, help advance medicine in many ways. we'll see things go much faster. But on the other hand, the side of the technology where you will no longer be able to tell what's true from not, in terms of photos, videos, there'll be so much fakeness around that people will stop trusting the system, and it's tough when you can't trust things around you as a human being.
Yes.
The other thing, unfortunately, people got quite isolated with social media for so many years, and it has caused a lot of issues with depression and anxiety. It's the mal du siècle, anxiety, because people do not fit that profile that social media are pushing. This is one way, one reason for anxiety. The other problems of the world are another reason. But as there will be more isolation, because that technology keeps getting better, people will have a girlfriend, a boyfriend, a sexual partner, a doctor who advises them, and then they'll hit reality at some point. You're going to have a lot of depression and people harming themselves because they're hitting reality. And there are already lawsuits, and you're probably aware of that. So I'll tell you frankly, Judy, I wished we had less technology around.
Yeah.
I'll say it frankly, back to maybe the old analog phones. There is so much around, and we're forced to deal with it. And we're seeing less humanity. We're seeing, more things going in sorts of directions. That's another thing. But back to your question, I think, that nothing replaces proper expert advice, care, managing any problem, and providing the right solutions.
Something not talked about enough is post-care. Even me as a patient, when I go to dermatology clinics, I do really value a doctor's input after the treatment is done. They check in, they're there to answer questions. ChatGPT is not going to replace that. You don't have that, so you need that care afterwards, because things do go wrong, or you have a question, follow up.
Of course.
It's your face. It's important, So it's important that we are mentioning that here, because I think we are relying too much on AI, ChatGPT, social media, when sometimes there are jobs that no matter what, AI cannot replace.
Yes.
Which is a lot of it, like you said, medical field. Even aesthetics, as much as you think it can help, it's not going to actually do the injection, is it? It's not. How can it do that? So at one point you need to embrace that, like use it to filter doctors' research, but then actually get your opinions from the professionals.
Correct.
In my opinion.
Yes, agree.
So, next on the subject of opinions, there's a lot of celebrities out there that people are looking up to, or on the other side are giving us inspiration on what not to do, because unfortunately they're doing too much, like we mentioned. So Kris Jenner, Lindsay Lohan.
I knew you'd ask me this.
Yeah, I mean, it's just everywhere, and I need your take, because they do look amazing. I'm going to say it here, like they're doctors, they've done such great work, whether it's a combination of treatments or whatever. It's not really about assessing what they've done. I really want to talk about what is normalized. So this level of perfection is not really attainable for the everyday people that financially, I don't know if they can afford a $300,000 facelift
That's
treatment.
Crazy, Trudy.
Crazy. And the number of procedures. Exactly.
Yes.
So what's your take? Like, how can we look to them as inspiration in a healthy level?
Look, first, all these celebrities, for every well-done celebrity, there are way more that are not well done, that are, if not botched, at least they're not looking their best. And remember that, all these pictures that you see, these people, you're not seeing them waking up in their pajamas in the morning. You're seeing them, in pictures, with makeup, with dresses, with the hair down, and so on. So you really don't know what is real and what's not. What you mentioned, Lindsay Lohan. Lindsay is in her mid-30s. I, frankly, know her personally. I don't want to say more than that, but Lindsay has a beautiful face. Lindsay had a period where she was not looking her best. So now that she's looking naturally enhanced, I think the drastic change has shocked people. But what she looks like is attainable to every person. Just minor adjustments, minor tweaks that bring her face back to life, if you want. And this again is like a little bit of a few things, especially when people have an attractive face, the nice proportions, and I don't want to also send a message that beauty is so important. Energy is more important. Self-confidence is more important. What I like to instill in my patients is that, you have to feel good in yourself. And this comes from many things. Attractiveness is one of them. But, knowledge, being smart, being well educated, being well read is also very important. And I'll tell you something, just because I don't want anybody to think that we're talking about, beauty as being essential, because this is the pressure. A lot of beautiful people who are applying to a job might be considered, maybe too, it might be even a liability for certain things. So what matters is knowledge and looking good. And looking good is attainable. A la Lindsay, the Kris Jenner who had a facelift, I really think she lost weight as well. And that has helped her face look, smaller. These are extreme cases. A lot of people, again, in my practice, do not need that facelift. They just need these tweaks. And these tweaks, when they're done regularly, they maintain their looks. One of the anecdotes I'm so happy to tell sometimes to my patients is now like a 65-year-old lady who I followed for about 17 years. She's from Kuwait, and I see her between Beirut and when I go to Kuwait occasionally. And one time I looked at her and said, since I know you haven't really changed much. She said, doctor, not only this, and I see her 3 to 4 times a year, we do our little things. She said, not only this, but I feel more beautiful and more feminine now, in her early 60s. So there is no magic to this, Judy. There is certainly some talent. There is certainly, this is okay, that's fine. But it's the approach that is proper, that is customized, that is minimalist, and that is restorative with little enhancements here and there. Restoring alone is great, makes people look natural. They look their best. Enhancing a bit of lip filler, it goes in with time. A bit of slight cheek enhancement is important. But more than that, it's really taking people in the wrong direction.
Because we're seeing people jump from 0 to 100 because they see like these benchmarks and, she had a facelift. That's my only option. I'm going to rush to a facelift. That can be detrimental
sometimes. This is going
sometimes.
back in time. And I say it with, as much certainty. Yes, there are now new techniques that are helpful with surgeries. But if you have a good doctor who's doing the proper restoration, and especially if you have thick skin ages better. If you have a good bony structure, I'll tell you, most people will not need that facelift. And now, with the advances that are coming up in the pipeline, I think
you can at least
in restoring the elasticity of the skin and doing all that, we can do a lot before that stage. So please save your $300,000. These are ridiculous amounts, especially when people travel all the way, to the US, and then who is going to do your follow-up? You stay there for a month or two, and I see, being the dermatologist that I am, I see the reverse of the coin. The people who go and that pay fortunes and come back either with a minimal change or with some complication. Things can go wrong, and the more you do things that are complicated, even in the best hands, things can go wrong. So I want really to temper down people who are getting too excited about the facelift. And then you have, unfortunately, some, I don't want to call them unethical, but really some maybe slightly commercial plastic surgery, put down, don't do fillers anymore. You have the migration, there's always a case of a filler that will stay on the bone for many years. We always knew that. It's inert, it doesn't bother. So a filler that stays 15 years, hyaluronic acid, that's known. We knew that. A filler that migrates is very common in the wrong hands, especially around the eyelids, around the lips. So this is where we inject the right type of filler, the right amount, so we don't cause migration. And in fact, we have so many technologies today around the eyelid. That's an area that I love to treat, so we need to do way less fillers, and we're doing more procedures. The tightening devices, the lasers, we clear the dark circles, we tighten the skin, we add the skin boosters, all these trendy things. They're very helpful. So, social media has been a vector of a lot of misinformation. That's kind of passive, and disinformation that is actually, people meaning to make you think a certain way and go to them to get this,
yes,
you know,
it's kind of
very
the
expensive
fear-based, like,
procedure.
you know, like fix yourself, fix your identity.
That's not
This
what a
is
doctor
what's-
should do.
Yeah, we don't want to feel worse when we come to you. We want to leave your office, even if it's a consultation, to feel like hopeful, to feel motivated. Okay, they're going to help me feel like me, but just a more restored, rested version of me. That's the whole goal. If we're going to leave you feeling worse about ourselves, then thank you, no thanks, you know? When you mentioned eyelids, I know it's one of your expertise and your passions to discuss this because it's overlooked a lot of the time when it comes to aging. So tell me, why is the eyelid area so unforgiving when it comes to aging?
Because the skin is so thin, you know, because the area is so delicate. You have the globe, you have, you know, your vision, you have, and it's so right in the face. Anything that goes wrong will show. For the longest time, this was an area where, like, you know, nobody goes there. You had some creams, you have some peels, and peels, you know, they're using chemicals. You know, you also want to be very careful so you don't get the peeling agent into the eye and so on. But the eye area is really what gives people their age. You see people who are really, they've had a nice Botox effect, they've had a nice clear skin, but then you can tell their age from their eyelids, or of course the hands,
And the neck.
or the neck. But we also have, you know, now the neck has been, you know, it's no longer the next frontier. It's already territory that we can help a lot with. But the eyelids are still an area where, you know, that needs a lot of expertise. That's kind of rare. And when we know how to use the lasers properly, and we have many types of lasers today, from the non-invasive to the little invasive to the invasive, depending on the condition, on how much loose skin there is, how much pigmentation there is, we can get really great results. In my, you know, humble opinion, in my practice, there are really one surgery that I still recommend. It's the upper eyelid surgery. That's the famous blepharoplasty.
Yes, upper bleph.
Some people need it at a younger age. Some people even later, they don't need it. While on the other hand, the lower eyelids, I almost never recommended the surgery to be done unless there is the puffy eyes and you have the excess fat, in which case removing that fat from the inside of the eyelid without removing skin is very important. Because when the skin is removed on the outside of the lower eyelid, and it's rarely a surgeon issue, it's more of the healing issue. And sometimes, of course, the expertise of how much to remove. You end up seeing the white below the pupil. And when you see this is immediately taking 10 years, and it's so hard to reverse.
Of course.
So better avoid it, get the upper bleph. A lot of people need it, you know, past their, 40s usually and higher. The surgery is usually quite easy. It's often like a home run, and it tends to last like 10, 15 years. But on the lower eyelid, if there is fat, better remove it from the inside and, see a dermatologist who specializes in tightening procedures to tighten any loose skin that's gonna be residual in that area.
Can we clarify, the brow lift versus upper bleph for our audience? Because it's confusing.
When people have very low set brows, it's useful to raise their brows, and then that opens the eye, okay? And only removing the excess skin here doesn't necessarily help them. Getting the brow lifted, on the other hand, is quite a complex procedure. It can be done, endoscopically by, the facial plastic surgeons and these, it takes a certain expertise. The procedure whereby it's lifted from the sides, I find it like minimally helpful, but it helps some people. Sometimes it can be done through an incision over the eyebrow. Depending on the skin quality, it can look great, and the scar can be invisible. In others, it can be a bit more visible when it's done in a direct way, but we use lasers to polish it. So the information that we had 10, 15 years ago is always getting revised, because with lasers, with advances, things that couldn't be done before can be done now. So brow lift if the brows are low. And if we cannot lift them with a device that helps tighten the skin, like the HIFU or others, or with Botox alone, or with a temple filler.
So another side of the upper bleph could be where it goes wrong. So there's celebrities that we're seeing now where they actually have a hooded eye, but that's part of their appeal. Yeah. The baby face looked good on them, but when they removed it recently, I'm thinking of one, basically she has hollow eyes now. She lost weight as well. She looks double her age. I think she looked better before. So when is it where someone listening to this thinks they need one, but they're like, maybe it actually suits them to keep their hooded eyes because it's their character,
Look,
right? It doesn't work.
This is where that consultation is
Yes.
important. You know,
So, like,
talking
you
to the
can't hear
people,
it.
knowing who they are, what their personality is like, because a lot of even, you know, big surgeries, expensive surgery are done, you know, to suit a certain profile that might not fit someone. There are a lot of celebrities today, and some of my patients that have gone, I haven't seen for a while, then you know, they kind of come back. I see them like having that square face, and you know, there are, you know, a lot of Sculptra and, you know, the PLLA, without calling, you know, where you see patient you know, celebrities or people around you who used to have a slim, you know, face that is oval, that is heart-shaped, and now they have that square looking face. That's often the excess of not only the hyaluronic acid fillers, because now you hear a lot, don't do HA, don't do fillers, do this, do this. But this is another type of filler that might be less lasting, like the skin boosters, the deep skin boosters, or this, you know, PLLA, Sculptra, Radies, all of these things that with time can, you know, give you large faces, white faces, square faces, women that look different. And I've seen, you know, we've seen celebrities that were like this, now they're like that. So this is where, back to expertise.
Yes.
And the perception of people, and that, oh, I'm no longer doing filler, I'm doing this. Fillers, at least the HA fillers, are reversible. We can dissolve them. Some of those so-called skin boosters today that are done cause enough collagen that we cannot undo them.
But something that's not talked about a lot is men and their aging process. So compared to women, you were mentioning earlier how women are tending to get wider here when they do fillers sometimes over time. Men, maybe that would suit them, right? So tell us the difference though with like a men's symmetrical face.
Look, a jawline is, you know, has always been considered like a wide jawline, a sign of strength. You know, if you're more likely to become, and that's been written, and you know, to become a president of the United States if you have a wide jawline.
Wow.
So it's perceived as authority, as strength, and so on. So you don't, you know, and I'm a feminist, I'll say it, you know, and a wide jawline can look great. You have like the Cindy Crawfords of the world. It's a nice thing, but it doesn't necessarily suit everybody. And this trend is going away. It's just to be called the Texas thing. And I never understood where this came from. Anyway, but look, the man and the woman, it's nice for them to look harmonious. And I see so many beautiful women who take care at every level. And then, you know, their husbands are kind of low profile, low maintenance, and you don't see that harmony. And I personally, to me, you know, this is one angle of why men should take care of themselves. You know, you have another angle, and in my practice, you know, in that field of rejuvenation and so on, about 15% of my practice is men. The husbands of the patients, or men who finally bring their husbands, or, you know, single men or whatever. You know, you work hard all your life. You're successful, or you're not necessarily. You're happy where you are, but you look in the mirror and you know, you see a face that is tired. So the point in men, just as it is in women, is to look rested, to look your age, not to look older, to maybe restore some hairs, to have, you know, the hairs in women and in men. It's like the crown jewel.
Yes.
And when the hair is thinning, people look, you know, older. So whether it's hair transplant or a little Botox, like I get done by my colleagues to myself, just to get that area looking rested. I can, you know, they still can move. They never want to look kind of cocky or done. And you see that sometimes. You see men who look overdone. And we've mentioned names in the beginning. So it is perfectly normal for, you know, men to get some enhancements done, some HIFU to tighten. The facelift, you know, can be hidden in a woman, but try to hide it, and try to hide the scar in a man, unless they have really long hair. So they are even more suited for non-invasive procedures, so that they look rested, they look good. They never look done. And that's the art of what we do.
Yes,
you know,
never looking
done. It's a ton
done.
of art in using all this scientific stuff that we do, all these procedures. They need to be applied with art so that things look seamless and look nice. never done, as I
The
like
goal
to
for
say.
a man, in my view, is to look like themselves, just more rested. But
Yes.
there's other times where, for example, like Tom Cruise example versus Bradley Cooper. Bradley Cooper doesn't look like himself to me.
Because he's had like the commercial work. The big cheekbones, you can see his temples are so hollow, so his face looks like a skull. His brows are, I think, elevated.
Yes.
I haven't looked. So
It's
he's
a
had
bit
I think he's
tight
probably
in
had the
look.
forehead
Yeah.
lift when he, you know,
his eye shape is different.
The brows that are elevated look nice on a woman.
Yes.
But in men, they don't look great. So low set brows, that's a typical thing. You know, you don't want them as low set as Clint Eastwood, where they're literally.
You can't see their eye,
that's his natural look. So customization is important. The other thing is what we treat sometimes is not necessarily looks, it's more like the energy. And that happens more commonly in men, maybe, but also in women. People who frown all the time. And frowning is contagious, just like laughing is contagious. You laugh now, we all start laughing. You frown in a meeting and everybody starts becoming nervous. So, and I get a lot of men, but also women who say, you know, I want to get rid of this frown. Because everybody's asking me, why am I angry? Why am I nervous? And I'm not. But
the resting
you get
angry
into this
face
habit
yes.
of frowning, and it exudes a negative energy. So restoring that is important. An anecdote from my practice was, you know, from a long time, a nun came to me, a nun in her robe, and she said, please, I want to get rid of this. Without asking her why, you know, I said, you know, okay, why not? Because she really had deep 11s, we call them. And she said, doctor, you didn't ask me why I'm getting that. I said, why? She said, because every time at dinner, we're sitting with the other nuns and they look at me and they say, why are you upset? And I'm not. And another story in this, maybe in another month, was a man in his, like, middle-aged man who clearly was so low maintenance, really, you know, like an average, you know, guy. And he said, I just want you to remove these. You know, his sister used to come to me. I said, sure. He said, do you want to know why? I said, of course. He said, I'm a car salesman and I'm a used car salesman. Every time I have a good deal, I can't help it. I have I smile and I don't want to give it away that I gave, you know, I got a good deal. I just want to have that poker face. So, you know, the energy part of what we do is something we can tweak, and it's important because, and there are studies on this, people who get Botox in this area, who have depression, you know, if they have major depression, they might go down to a minor depression, or sometimes they really get so much better that they no longer have depression. These are studies that came out from, you know, psychiatric departments. So looking good is always, you know, makes happy. You know, we haven't reinvented any information here. And removing, you know, signs of aging or signs of fatigue or signs of anger or something make people.
And also we could just say it's like, I have 11s because I wasn't able to see well before my LASIK eye surgery.
Yes, of course.
So like it's a stigmatism issue. Sometimes it's a physical problem, you know? Sure. So if you maybe like freeze it a little bit with Botox, it helps, you know, so that you don't always do this. It's a habit thing. So that's true. It's a physical thing. How about with younger clients? So now it's a whole nother podcast, but it's becoming more and more prevalent for these younger individuals to come in. What are they asking for usually?
Look, there is this trend of Sephora kits, you know, trends on TikTok, you know, Snapchat, all of that. We're seeing major league acne on kids who are overusing, and, you know, they want that glassy, you know, shiny face. So they're overusing either oils or moisturizers or whatever. And, you know, kids coming in with bags of things. And we all have like nieces and nephews, no, not many nephews, but a lot of nieces that are doing this. So, and this is pure marketing. This is pure marketing that's generating a lot of sales in that segment. So either allergy problems or acne problems that we have to deal with, or, you know, getting these kids into this unrealistic beauty. You know, we're seeking beauty all the time. You know, I think kids, they should live their age. They should be in school. They should be worried about exams, about scores, about athletics, about, not how they look and how they want to stop aging. And the scary thing, Judy, now, and it's something I've seen in my clinic more than once, are teenagers, so 16, 17-year-olds, who are going en masse, like 3 or 4 from schools, in Beirut, and I've seen it in Dubai, and finding injectors, doctors who are willing to do lips or Botox on them without parental consent, which is huge and
That's
catastrophic. So this is where I've been on interviews where we're really trying to sensitize moms and dads that this is completely unacceptable. And there is becoming a bit of peer pressure on that. Just like they have the smartphones, I should have it. Everybody's doing that. I want to get it done. And, if we don't watch out to this trend of teenagers seeking perfection, seeking, injections already, the trend is only going to get worse. And, it becomes like a snowball.
Yeah.
There is nothing wrong. I'll tell you, as a dermatologist myself, I have treated 16, 17-year-olds who have a major imbalance in their face somewhere. As long as their parents are with them, and if it is something that's really affecting the appearance or the psychology of that teenager, it might be fine in really exceptional cases. I'll say it as it is. But for this to become a trend, and a trend that is out of control without parental consent, is really scary.
Yeah, I mean, I actually have a family member that was saying that their friends are just going and getting lip fillers for fun, like it's a party. Yeah. I've never thought I would see that at 17 years old.
And the problem is that there are regulations. In no medical office you should get a procedure without signing a consent. And if you're under 18, you cannot sign a consent. It should be signed by a guardian, which is the parent. So if these, teenagers are getting these done, where are they getting them done? And like behind the curtain in a spa by some illegal practitioner. This illegal practitioner, since they're practicing illegally, they're using products that might be low quality, that might react with time, products that might actually cause infections. So it is, it could be like a major catastrophic thing.
How about the development of these kids though? I mean, would it affect them, Botox, filler, because they're still growing, their bodies physiologically, they're different than, full-formed adults. Would this affect them?
Not really. If it's done properly, no. But the thing is that it shouldn't be done at that age.
Just the idea.
And I'll tell you something, Trudy. One of the very few good news I've heard in 2025, back to the social media thing, was in Australia, banning social media for 16 and lower and younger, because it's really so much pressure to do things that no family would accept, so.
Tell us about a case quickly about somebody coming who is underage that you've had to tell them bluntly, no, I can't do this for you. You have several?
Yeah, of course. And sometimes with their moms, and they come in, and then look, a good doctor would treat everybody as if they're family. And I look at them, I say to myself, this was my daughter a few years back. Would I have done it? And if it's a no, I would not do it. I would convince her and her mom that this is not the best thing for her. What can happen, and what is scary, is that they might come out of my clinic and go to somewhere else who might say, yes, of course, let's do it. So we always have to manage this. And the peer pressure is huge. And again, the proper upbringing in the family, talking all the time, giving those, communicating with the kids, giving them the self-confidence that, they want to live their age, that maybe after 18, after 20, they can start doing things differently. I think every stage of life needs to be lived properly.
And just a reminder that these kids are still growing into their face. They're still developing, right? Through their 20s. So their nose might feel big now, but they might grow into it. So don't rush to do something.
So surgery usually is not done except for some extreme cases of noses or like jawline severe imperfections. But, in general, the tweaks that we do, they're not going to affect how things are going to go. It's just the principle, the whole idea, the philosophy of whether we should be doing them or not. And I feel strongly that, there's an age where we shouldn't be.
And emphasize that there's more to life than looks. At that age, they're very impressionable, right? So if we're focusing on beauty, What they have so much
Look,
more to offer.
there are, you have so many things can be done. And I've had really young who use so much their foreheads that if you look here, you think they're 30 years older. So sometimes you really want to put things back where they should be so they look their age. Sometimes they've had so much sun damage that we might do a laser that we normally do in the 30s and 40s. I've done it recently to a 17-year-old.
It's like a restart.
Such sun damage that really she looks older and the skin is not healthy. And so, there's always exceptions, of course.
So emphasizing aging well. So what does aging well to you personally look like? If you want to define it.
Living well. Living in a healthy way, managing your eating, having a good breakfast. I feel strongly about that. And then less and less portions as you go in the day, avoiding smoking, minimizing exposure to sun. I say minimizing because, sun is healthy. It's part of nature. And there is so much overemphasis on using sunblock that, you end up, you need some sun. Now, if you're really fair skin, your sun exposure should be very minimal. Okay. If you have darker skin like myself, I can handle some sun exposure. It actually feels good. It's okay. It's not the end of the world. When you have acne, if you get a bit of sun, it's actually good. It helps. Acne, UV helps reduce the bacteria that can worsen. So there is nothing that is extreme in life. There is no 0 and 1. There is the whole spectrum in between. Again, of course, sun protection is very important. Avoiding the sun in certain hours. If you have the very fair skin types, you really want to avoid most of the time. The problem is aging, the risk of cancer, the risk of spotting, and all that. These are obvious things. I just wanted to have my 2 cents on, a bit of sun is also
There's
good.
There's a lot of different opinions around that, yeah.
But there are also facts and experience.
Yes, yeah.
And Judy, avoiding smoking, reducing alcohol. These are important things. And then doing the procedures and doing the skincare that is adapted to one's age. We start with, other than recommending sun protection, hydrating when it's necessary. Overhydrating causes acne. I see this every day, young and adult, men, women. If I use a moisturizer 2 days in a row because I have healthy oil glands that secrete the oil, I get acne myself at my age. So this is very important. Using vitamin C, it's a good antioxidant in the morning. Maybe using retinol, not for everybody. Using a little bleach once in a while or an exfoliant. Doing a glycolic acid peel every quarter, every 6 months, depending on your skin quality and so on. And then you get to, depending on how things are aging. One thing that I like to restore is symmetry. Before we're trying to make people look their age, a lot of people have bad asymmetry. I have some. You don't have much. Okay,
I hope.
You're
I'm
perfect.
like, don't say it now.
No. But no, of course.
No, it's
but
fine.
Restoring, because a lot of people have one side that they like more than another, or they have a smile that goes one way or the other because one side is smaller, the side that we sleep on. So restoring symmetry is important, and it takes an eye to see it first, because if you don't see the asymmetry, you'll never fix it. You'll never treat it and make people look their best. And sometimes only restoring the symmetry. Sometimes I use a whole syringe of filler or more on one side, don't touch the other, and they look perfect because the smaller side might be looking more tired. So treating this and doing a treatment plan that's customized, that is with the goal of restoring, maintaining. There was an article that I read, a general article, about, how everybody around New Year's talks about a New Year resolution. What am I going to do? And, most of the time, you don't change anything. And this person was making the point that what we really should work on is maintaining the good things in our life. So, I've been exercising. I want to maintain exercising all the time. I've been taking good skincare, care of. So maintaining one's skin is the whole is really what we do. So you want to maintain your good looks. And this takes really a dermatology diploma on that wall, and with a fellowship and with a lot of experience to really know how to do it, to maintain the shine of the skin, the integrity of the surface, the elasticity, the volume, keep the skin from being overexpressive, and keep people looking 35, like your amazing title, for a very long time. It doesn't take, there is really no magic in this. It's about knowledge and applying it properly in a personalized way.
I think just like everything with eating well, movement, as long as you're consistent, you do most of the work at home, the add-ons in the clinics are going to help you, of course, and speed things up. But you need to do the maintenance. You can't do a miracle pill with one session and then just say everything's ready.
Yeah.
You need to do the homework, basically. Who, in your opinion, which culture has the best relationship with aging that you've treated when you've a lot of diverse clients?
I've worked 12 years in the US. I'm Middle Eastern. I'm Lebanese, and I work a lot in the Gulf, and I've been consulting in the Gulf for a long time, and have had my practice in Dubai, splitting it, between Beirut and Dubai. The North American, at the time when I was there, so I was there till like the 2003.
Okay.
It was extremely conservative. So just a bit of like very little things. I know now, observing from far, that they're going in the other direction. It has changed tremendously. I can't, there is not one place, maybe because I'm Lebanese myself, I like how the Lebanese take care of themselves. People in the Gulf are also very conservative, but there is nothing that really cultural. There is an appreciation for beauty that can vary from one culture to another.
Yes.
And we tend to have it more acutely. And it's not really, I don't think it's a lot about, seducing the other sex as much as,
it's about confidence.
It's about confidence, but also pleasing the group that you're in.
The community.
Culture. And you see that in certain communities, people more or less, have the same.
They look similar.
They look similar. The same, more or less the same hair or the same style. So it's kind of an identity thing that people like to do. I personally, if I do what I do well, it's because, I'm a bit of OCD, I like things to be in their place, to be proper and so on. So I like it when people take care of themselves. So this Lebanese Gulf, I find, at least the people who come to me, and the people who come to me know that, they want a conservative, they want a natural looking result, and they don't want too much, because those who want too much already know I don't do this, so they don't come to me. So the practice that I have, wherever I've been in the world, has been people knowing what kind of work that I do and wanting that. So it seems to, I seem to attract those people, and, that's how it works with all practices.
It's a beautiful transition to our ending, because it's actually one of my questions for you is, what is a red flag when someone is going to choose a practitioner? For you, what should people look out for if they're interviewing different practitioners, and who should they go to where they feel comfortable?
Look, they want to look up who that doctor is, the credentials, the training, the education. It's very important. They want to, of course, hear from other people, word of mouth.
Yes.
Gratefully, my personal practice is 95% word of mouth, and that's something I'm proud of, and that's how it is, and that's normal in most mature practices. Seeing results, and now everybody has access to seeing results, but again, with a disclaimer that results can sometimes be fake if the practice is not very honest, and now with the deep fake of AI. So typically, it's a combination of two things: of word of mouth plus looking up, like an Instagram profile. I consider Instagram as my showroom where I can show a little bit of my work. I can communicate some of the things that I think are important for me to raise awareness about, and show some before and after pictures to our patients, and show them what can be done, because a lot of people still don't know that certain birthmarks can go away with laser, or certain things can be done that can be life-changing, and we take it kind of for granted. So ask around, do your research. Reviews are important, but they're not so important. Sometimes you have people who have such expectations and they lash out on a review. And I think everybody knows now that the very bad reviews are sometimes like more psychological things,
something
or really
they're going
a bad
through.
thing that has happened that's very unusual. So it's a mix of everything. And then, talking to the doctor, getting a feel of experience, of honesty. This comes across. This cannot be, people are smart enough to get a sense of whether you're getting real good expertise, an honest opinion, a doctor who says no, a doctor who is not rushing things. That's important.
So we got a few questions for you last night. I need to ask you quickly because it's very important. One person's just asking, when should they start retinol in general? Is there like a rule or it depends on the skin?
Depends on the skin, definitely.
Okay.
But, less is more. It never hurts to start it in, I would suggest in the early 20s, small amount, spreading it all over the skin, never too much. Because
so
then
early
you get
20s
irritation. Yes,
in
of course.
general. Okay.
In most people,
I missed
think
that boat.
without seeing that person,
Yeah.
but you also have great skin.
Oh,
So
thank you.
it's okay.
I mean, with everyone's help now. So is Korean beauty a fad or is it really that good for your skin?
It's definitely overhyped. And this is
Okay.
another hype that we have to deal with. The Koreans look great because they have very thick skin. They have good jawlines. In fact, they have a problem with square faces, so they get heavy injections of Botox to slim the face, but they have such great skin and their products are good quality, but they're definitely
and also
overhyped.
The weather in Korea is different than here,
and
right?
then they
so
drink
the
green tea and they're not big smokers and the culture is not a sun culture. They're not people who are lying down in the sun like we tend to do.
Yeah, we're in different environments. How about lasers like pico or fractional? Does it damage the barrier or is it good for you?
Depends how it's used. It should be good for you if it's used properly with a certain sequence or certain frequency with certain parameters. Again, back to the Ferrari, you either use it properly, get performance, or hit a wall.
Or it's not good. How do you target jowls? Is there one way?
So much. A lot of people grind, and I don't know why. So many people grind at night, and most of the time I look at someone and say, "Do you grind at night?" And it's like a yes, because the normal features, the cheekbone should be the widest on the face. When I see someone who's wider here, it's typically the masseter muscle that from grinding that becomes bigger and bigger and bigger. And it gives you eventually this trapezoid face. So when the jawline is a bit too large, it's usually the masseter that we inject with Botox and slim it down. And we also protect the teeth from over grinding and spare our patients from wearing the mouth guard for a lot of time. When the jawline is very small, you lose that definition between that border between the cheek and the neck. So a bit of chin and jawline filler is very suitable, whether it's HA, hyaluronic acid, or the calcium or others, doesn't matter. As long as it is done to a certain extent that doesn't masculinize the face and make it too wide.
Depends on the
sometimes
frame.
I see, patients who have been overfilled, so I take my hyaluronidase, which is the solvent of hyaluronic acid, and tone, dissolve some of that. So there are many things that we can do. We use the HIFU technology to tighten the skin, and that's superb for most patients.
So that lifts
but it's not
enough
alone, because if people have strong muscles, you need to calm this muscle and then do the HIFU. So it's the HIFU is like this big cherry on the cake, but the actual cake is putting the structure of the face back, the proportions, the volume, resting the muscles, and then doing that.
So not just looking at the saggy jowl skin, it's the whole jaw
it's
and the whole
thing,
picture. See,
yes.
not a lot of us know this, right? We just go in saying, I know it's this laser, I want to do that. But you're saying
and
there's another background.
Yes.
Yeah, okay, see, I like hearing that. How about the last question? How to treat a dull and tired looking face reasonably? That's a general question.
Look, the thing that is very useful is kind of a laser peel.
Okay.
Removing the dullness is usually retained dead cells that haven't been exfoliated. So exfoliating that with a laser peel or a chemical peel, getting some tightening, reducing the pore size, that's
really
usually
an easy
very nice.
story.
On the other hand, if there are a lot of hollows in the face, you get shadowing. And that dullness could be from the shadowing, from deep crevices. And this is where a filler would kick in. So
it's not a one-size-fits-all answer.
It's like anything in medicine, Judy.
Yes.
If you don't recognize the cause of the problem, you're not going to find the right solution. If you apply solutions on all the problems, it's going to be a hit or miss. Sometimes it's going to work. Sometimes it's not. It's not going to do anything.
Or it causes another problem. So
yes,
then you
of course.
like even in medicine, same thing. So, Dr. Dany, at the end of the day, we both agree that this is about balance and education and about normalizing the desire to feel good without losing yourself in the process, because informed choice isn't pressure, it's empowerment, right?
Absolutely.
So, thank you so much for your thoughtful discussion. We answered so many questions, so many facts. I hope you also feel like you had the platform to kind of tell us what your passions.
Certainly. Thank you.
And honestly, it's really important for people to do their research, feel comfortable with their doctor, and not rush the de-aging process, to age gracefully instead.
Absolutely. This was a very balanced, and I hope really not boring at all. Yeah.
That was a great one.